Today we are going to have a heart-to-heart conversation about what did I see or what do I see in patients of Parkinson's disease. Let me tell you, I have been treating Parkinson's disease for my last 26 years and must have seen thousands of patients. There have been several aspects of these patients that have touched me and which I feel today I should share with you. The first and foremost aspect that most of the patients come to me asking is, what will happen to me tomorrow? This is the concern. Even if I was a patient, I would have. Why do we have this concern? We never ask the patient of when we go for a diabetic checkup or for a blood pressure checkup to a doctor, what will be happening to me tomorrow? We just go ask and tell him that, sir, please control my disease properly. The main reason for this happening is because we do not have adequate awareness. We do not know what would happen next. To me, I don't see Parkinson's disease as a very debilitating disease. Yes, it does affect your motor function, it does affect your movement, but in today's modern science of medicine and surgical therapies that are available to us for the dealing with Parkinson's disease patients are so efficient that I can assure you that we can give a very good quality of life to most of the patients for a largest amount of period that they will be living. So this is what I assure my patients when they ask me what would happen next. Some patients are so concerned, they ask me, sir, would this affect my children? And this important aspect is very important. Only few percentage of patients of Parkinson's disease that we know of today. We are knowing and getting new knowledge every day, but only few percentage that we know of today are actually genetic. So I don't think a routine patient of Parkinson's disease should ever be bothered whether it will be transmitted to his children or not. Is there any way to slow this down? This is the third question that I am asked by my patients. सर कुछ दवाई दे दो इसको स्लो डाउन कर सके या तो इधर रोक सकते हैं सर आई कैन अंडरगो एनीथिंग एंड एवरीथिंग इफ यू कैन स्टॉप इट हियर unfortunately no doctor is god and we cannot stop the progress of the disease. However, let me share with you some important information. Recently we conducted a study, a research study at Jaslok Hospital on offering dance or music along with meditation to patients of Parkinson's disease, and we could found that in the patients who underwent this treatment, it is a treatment. It was not as a recreational thing. It was properly supervised medical program because we wanted to actually check the impact. And this particular recreational treatment that we offered to the patient actually showed us that we could slow down the patient's progress of Parkinson's disease by 2 points, which was very important because this was a very short-lived research project, and hence within that short duration also we were able to show a difference of totally 4 points. The patients undergoing treatment had 2 point decrease in the debility scores, whereas the person who were not undergoing treatment had 2 point increase. So the total difference between these two groups was around 4 points.